If I were to ask a group of people to define what core training was, what did it look like and what it was supposed to benefit and the different types of core training, I'd probably get a ton of different answers. And that's totally okay, because when we talk about the core, it's like talking about cars. Just talking about cars is general. There's so many nuances and specifications and variations. Same with the core. My name is Dr. Jocelyn Conley. I'm a pelvic floor physical therapist, founder of the Vagina Doc, and in this video, I'm going to talk about a specific type of core training called reactive core training. Before I get into that, let me just talk about 3 general types of core training. We've got general postural control core training, which is what you think of when you're doing planks, side planks, things like that. Then we've got the reactive and anticipatory core training, which is when the core is looking at something or knows about a task. Let's say you're in a plank and it knows that you're going to tap your leg out to the side. So it knows to respond to keep your spine in neutral and to create optimal tensions to do it. Whereas reactive is your body responding to an unexpected perturbation or a process that's happening within the body. If one does not train a wide variety of exercises that will cover all those the 3 things that I talked about, then there's something missing in their training. So we're going to focus on reactive core training as it relates to the pelvic floor. When many people have leakage, it is often because they lack either, let's ignore that they don't have endurance. Let's say if their pelvic floor is strong, it's endurant, but still leaking with like jumping and running. There is muscle fibers within the muscle group and individual muscles within the pelvic floor themselves that are responsible to, they're like reflexive contractions, and they respond to the movements in the body automatically. That is, and they're really fast, so they're fast twitch muscle fibers. And we've got to train that. Because especially after a trauma like childbirth, if we don't train it, then we can't expect it to just happen. Modern society has taken that away from us. So with reactive training, when it comes to the pelvic floor, we can do it in different ways. We can move our legs and stomp to create a force effect up our body that mimics a force or an impact that happens like when we run. That's one way. The other way we can do it, really thinking about tapping into our fast twitch muscle fibers, is varying the way that we breathe. So when you're thinking about while you breathe, hopefully I've convinced you that a steady controlled breathing pattern should be your first goal. If you can't do that, then you've got to adjust your training somehow, whether that's intervals, whether that's speed, the terrain, etc. You may not even be ready for that. You may have to train the other surrounding muscles in your diaphragm. So when we talk, breath is just so powerful when it comes to training the pelvic floor because of how it moves with the diaphragm. When it comes to fast twitch though, we have to think about breathing a little bit differently. And so my favorite way to train the pelvic floor, fast twitch or reactively, even though that we know about it, pelvic floor, certain muscles, they're not as connected with the front of our brain as some of the other fibers, is a type of yoga breath called the O breath. So it's a powerful breath in, either in through your mouth or in through your nose. I think it's in through your mouth, and then a powerful breath out. So that's one way to tap into it, as well as the stomps. Or we can do it very specific to the task that we are trying to get better at. So it could be running specific, it could be jumping specific. If that is not put into our training plan, then we are missing something. First thing that needs to happen though is you have to be aware of those muscles. So sometimes I'll tell people to connect with their pelvic floor at the same time, other times I won't. So in the next few videos, I'm gonna go over a couple of reactive exercises that specifically train the pelvic floor reactively. Again, my name is Dr. Jocelyn Conley. I'm a pelvic floor physical therapist. We talked about core training, specifically reactive core training, the pelvic floor. If you have any questions, please post them below. And if you like this video, it was helpful, please press the like button. And then if you know anyone that can benefit, please share this video. And if you're not already subscribed, press the subscribe button so that you're notified every time a new video is dropped. Thank you so much for watching, and I will see you on the next video.